It has to be multidisciplined, so that it's all of the continuum of therapy, medical intervention, nutritional intervention, and even what we call physical wellness has to really take place. These people have to be really retrained in terms of letting go the diet mentality. And if you looked at all these things, the real crux of it probably is how our body relates to stress. So we're not talking about acute stress. So I'm worried, what's going to happen today, or I got a bill, or the car's broke. But it's sort of like this unresolved stress, and we can see that in a person who has been on diets and diets and feels the weight's the problem, and then that creates cortisol. They go on a diet, they lose a little bit of weight, they know they're sticking to it, but it's failing, that creates cortisol. I'm hungry, that creates cortisol. I'm not getting successful, that creates cortisol. They tell me to exercise, my knees hurt, I go out, I'm in pain, that creates cortisol. It's ugly outside, I hate this exercise, that creates cortisol. I'm not seeing any results from doing this exercise, that creates cortisol. Every magazine I pick up says I'm bad because I'm not thin. I would be successful if I was thin. This person's successful because they were on The Biggest Loser, they lost weight. This person's successful because they're in People magazine, they lost half their weight. Everybody's saying in the magazines, you can do it if you work hard enough. So with my failure, because I'm not working hard enough and I feel guilty and frustrated, so it just builds up this cortisol. And now that if you have those additional conditions of the trauma, of the attachment, now you have more cortisol, and so no matter what you do, it's like putting your fingers in a Chinese finger puzzle, where the more you try to get out, the harder it is to get out.